In this video, I'm going to discuss about the normal microbiota of the respiratory system. First, we know basics about the respiratory systems. Like respiratory system is divided into upper and lower respiratory tract, and it's most important entry portal for the microbes. And the upper respiratory tract is direct contact with the external environment. That's why it's more potent. And the nasal cavity is lined with hairs. There is the nasal cavity lined with hairs that traps large particles like dust and pollens and prevent the access to deeper tissue. But some bacteria virus also enter through the upper respiratory tract and infect the persons. Later I will discuss. Here, upper respiratory tract. The upper respiratory tract is under constant surveillance by the mucosa-associated lymphoid tissues, which is normally called MALT, including the adenoids and tonsils. And the other defense mechanisms include secretory antibodies, lysozymes, surfactant, and antimicrobial peptides called defensins. Normal microbiota of the respiratory systems are the upper respiratory system contain an abundant and diverse microbiota, and this nasal passage and sinuses are primarily colonized by the membranes of Firmicutes, Actinobacterias, and Protobacteria. The most common bacteria identified including the Staphylococcus epidermis, viridans group, Streptococci, Corynebacterium species like diphtheroids, and Propionibacterium species and Haemophilus species. Main healthy humans asymptomatically carry potential pathogens in the upper respiratory tract. As much as you know, 20% of the populations carry Staphylococcus aureus in their nostrils. So now some important respiratory diseases and vaccines, like there I discuss about disease, pathogen, and vaccines. For the disease chickenpox and shingles, their pathogen cause this disease by varicella zoster virus, and available vaccine is varicella chickenpox vaccine, herpes zoster vaccines. And common cold, as we know, it's caused by the pathogen rhinovirus, and there is no vaccine available in the market. And diphtheria, which is caused by the Corynebacterium diphtheria, available vaccine is the DTP or DPT, as we call it. And measles is caused by the measles virus. Vaccine is MMR, measles, mumps, and rubella vaccines. And mainly I will discuss in this video about the pneumonia, which is caused by the Streptococcus pneumonia. And vaccines are the pneumococcal conjugate vaccines, PCV13, pneumococcal polysaccharide vaccine, PPSB23. And tuberculosis is caused by the Microbacterium tuberculosis like BCG. Here about the pneumonia. Pneumonia is a form of acute lung infections. It causes mild to life-threatening illnesses in patients of all the ages. Some facts about the pneumonia is people at risk for pneumonia, including children less than 5 years, adults over the age of 65 years, and people with pre-existing health problems can get the pneumonia by the Streptococcus pneumonia infections. And it is the single largest infectious cause of death in children, where the 50% of the death we can see. And ventilator-associated pneumonia, which we call BAP, takes the third place among cause of death for ICU inpatients. As in the diagram, we see that in healthy person, this is the lungs, and in case of pneumonia, that's the condition of the lungs. In healthy person, there is normal bronchi, as we see, and in pneumonic persons, there we see the blockage of the bronchi due to the inflammations. And next is about the acute pneumonia, which we classified according to the community-acquired pneumonia, which we call CAP, hospital-acquired pneumonia, or we called medical care-associated pneumonia. And third one is the ventilator-associated pneumonia in case of ICU. According to cause, they are caused by the bacteria and other bacteria pathogen which has atypical pneumonia are chlamydia or mycoplasma, also caused by viral, fungal, protozoan, and co-infections caused by bacteria, and both bacteria and virus. And now is about the community acquired pneumonia is an acute lung inflammation caused by the microorganism acquired outside a hospital or other medical facilities. It's mainly outside, which is called community acquired pneumonia outside the hospital. Okay. And risk factor for severe community acquired pneumonia in adults are the diabetes mellitus, alcoholism, malignancy, asplenia, age over 65-year-old, chronic heart, liver, lung, renal diseases, as we see in that patients. And risk factor for severe community acquired pneumonia in children under 5 years old, or if he or she have the respiratory abnormalities, undernutritic children, or congenital or parietal infections including HIV, or not complete immunization or no immunization get this disease in children, and heart and lung disease also, and cystic fibrosis if they have, or CGD. Bacterial pneumonia, which is cause of the community acquired pneumonia in adults by Streptococcus pneumonia, Haemophilus influenza, Mycoplasma pneumonia, Staphylococcus aureus, Legionella pneumonia, and Moraxella catarrhalis. In children, we see this disease caused by the Streptococcus pneumonia, Staphylococcus aureus, Haemophilus influenza, Chlamydia pneumonia, and Streptococcus pneumonia. Mycoplasma pneumonia also cause in children. And in newborns also, we can see Streptococci B group like Streptococci agalacticia, or by Listeria monocytogenes, or by E. coli Escherichia coli. Laboratory diagnostics, sampling, and modern approaches by sputum samples like gram stain and culture, endotracheal aspartate samples in intubated patients like gram stain culture, antibiotic susceptibility test, or by the nasopharyngeal swab or oropharyngeal swab. For influenza or COVID testing, in case is co-infection or viral pneumonia suspected. PCR is more preferable than rapid test, as we know. And also we can get urine test where the pneumococcal antigen and Legionella antigen testing at suspicion for severe community acquired pneumonia caused by this pathogen. Blood is blood culture in patient with severe disease, as well inpatient empirical treated for MRSA or pneumonia aeruginosa, or patient with medical care associated pneumonia. Principles of antimicrobial therapy in children, we see that we divide in bacterial pneumonia, atypical pneumonia, influenza pneumonia. In case of outpatients, we will use amoxicillin, and in case of bacterial pneumonia or atypical pneumonia, we azithromycins or clarithromycins we will use orally, or in case of influenza pneumonia, oseltamivir also use. In inpatient, fully immunized against Staphylococcus pneumonia and H. influenza type B is for use bacterial pneumonia like ampicillin or ceftriaxone or cefotaxime, and vancomycin may be added at the suspected MRSA. And atypical pneumonia is caused by the azithromycins and treated by the azithromycins or erythromycin or doxycycline. We will use intravenously. And in case of influenza pneumonia, we will use the medicines like oseltamivir and zanamivir.